Did you know that perimenopause can begin anywhere in your mid-30s to in your mid-50s and can span anywhere from 12 months to 10 years? Yes, it is that varied, and some of the first symptoms that women start to experience when they enter into perimenopause are pelvic health symptoms. My name is Dr. Brooke Kolisiak. I'm a pelvic health physical therapist, and I am passionate about helping women navigate menopause and perimenopause with success and confidence. There are several pelvic floor signs that you may be entering into perimenopause. They include, but aren't limited to, irregular and unpredictable periods, vaginal dryness, pain with sex, and decreased libido, increased urgency and frequency with urination, as well as an increased likelihood of developing urinary tract infections. All of these signs can be traced back to the decrease in estrogen that happens as we enter into perimenopause and then menopause. Without estrogen present, our bladder lining thins and our bladder function becomes less predictable. We see a weakening of our pelvic floor muscles and a loss of support for our pelvic floor organs, thus leading to several of the signs and symptoms I just discussed potentially occurring. Decrease in estrogen causes a lowering of libido, a thinning and a drying of the vaginal tissue, which in turn can lead to bleeding with intercourse and pain with intercourse. Pain with sex is one of the most common symptoms we see in menopausal women here at our clinic. And I'm here to tell you that there are things you can do to help with this. First and foremost, think about using lubricant when you are sexually active. Lubricant is there to help decrease the friction. Some of our favorite lubricants include Slippery Stuff, Uberlube, and Good Clean Love. We basically want a good quality lubricant applied liberally to help decrease the friction, to help diminish the chance for pain or bleeding. Another option that's good outside of the act of intercourse is using a daily vulvar and vaginal moisturizer. Most women are used to moisturizing their face, but don't think about the fact that once estrogen is gone from the vaginal tissue, that tissue is going to be drier and could use a vaginal and vulvar moisturizer. So buying a high quality vaginal and vulvar moisturizer and applying it on a daily basis after your shower can be extremely helpful. Sometimes those two tips alone are all that a person needs to help them diminish their menopausal pain with intercourse. However, if you are still experiencing pain with intercourse after trying that, it may be helpful to partner with a pelvic physical therapist to look at some other factors that might be contributing. Your pelvic floor muscles might be too tense and tight and not relaxing well because of the pain, and this in turn can actually cause more pain. And if that's the case, then we need to figure out ways to stretch and relax and release these muscles, which may include using vaginal dilators or vaginal wand or other techniques to help get these muscles to relax and move more freely. We may also have other issues around the area because of that pain and tension where we're not moving well through the hips and the pelvis, and that in turn can contribute to the pain with intercourse. Or maybe we've got long-standing scar tissue there from previous vaginal deliveries or C-sections that's now contributing to the issues. So this is a good opportunity to partner with a pelvic physical therapist to figure out exactly what's going on in your particular situation that may be contributing to your pain so that we can get to the root cause of it and help you get back to having pain-free intercourse as soon as possible. If pain with sex is the number one pelvic health issue of menopause that we see in our clinic, you may be wondering what the second most common issue is, and that would be bladder leakage. So again, remember that when estrogen decreases, we start to see a change in and a thinning of the bladder and a weakening of the pelvic floor muscles. And because of that, women can start to see a whole host of different bladder issues. These issues can include bladder leakage, increased urgency or increased frequency, and or an increased likelihood of developing urinary tract infections. So these are all extremely common issues of the bladder that women can experience during perimenopause and menopause. And unfortunately, so many women think that this is just a normal part of aging, and honestly, they're told that by many of the individuals in the medical field. But I'm here to tell you that it is not a normal part of aging. It's common, but not normal, and there's things you can do about it. And so oftentimes it can be extremely helpful to partner with a pelvic floor physical therapist to assess what is going on with your bladder and your pelvic floor, to make changes in order to help you overcome these bladder symptoms. But even ahead of that, I want to give you some helpful tips for your bladder that can make all the difference in the world to keep you from experiencing some of these bladder issues of leakage, urgency, frequency, or increased likelihood of urinary tract infections. Tip number 1 for your bladder: do not go to the bathroom just in case. When we go to the bathroom more frequently than our bladder's telling you to, we can end up into some bad patterns where the bladder just keeps telling us to go to the bathroom more and more often. And that can be a hard habit to get out of. Tip number 2, avoid bladder irritants. Things like coffee, caffeinated drinks, spicy foods, really acidic foods. For many people, those can be very irritating for the bladder and can make it hard to make it to the bathroom in time, or feel like you have to go to the bathroom much more often. So avoiding those bladder irritants can make a huge difference. Tip number 3, make sure you stay hydrated. So many people start drinking less and less water when they are dealing with bladder issues, but this does the exact opposite of what we want it to, and can actually make urges stronger and the bladder more irritated because the urine in the bladder is more potent. So please continue to stay hydrated and not avoid water. Tip number 4 is, when you do feel like you need to go, sit down on the toilet, spread your legs, and let yourself relax fully and let the pee happen. This isn't a race. Don't try and power pee. Just relax and let the flow go to make sure that we're emptying all the way and that we're not putting too much pressure down through the pelvic floor or holding back too much. So those are 4 tips that you can try right now to help minimize any bladder issues that you might be experiencing. But if those tips alone aren't enough to help, then my suggestion would be to reach out to a pelvic physical therapist to do a full evaluation of what's going on in your particular situation so that you can get to be symptom-free of any bladder issues. So we just went over the most common pelvic health signs that you may be entering into perimenopause or menopause. As a quick recap, those signs include decreased libido, vaginal dryness and pain with intercourse, a change in the regularity and predictability of your menstrual cycle, and bladder issues such as urgency, frequency, increased urinary tract infections, and bladder leakage. If you are experiencing any of those issues and you are a woman in the age from mid-30s to mid-50s, then it's a good chance that you may be going through perimenopause and or menopause, which is the complete cessation of your period after 12 months after your last period. So if that's the case, please know that although these are common, these are not normal, and there are things you can do to get symptom-free. And I highly recommend partnering with a pelvic physical therapist to get your individual concerns addressed so that you can be as symptom-free as possible in your perimenopausal and menopausal journey.
Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.